Hey everyone, welcome back to the channel. In today's video, we're diving into the world of sedative drugs, what they are, how they work, what they're used for, and some important safety tips. Whether you're a medical student, a nurse, or just someone curious about how these medications affect the brain and body, you're in the right place. Sedatives are a class of drugs that slow down the activity of the brain and nervous system. Their main purpose is to calm the body and mind. They reduce anxiety, promote relaxation, and can even help with sleep. In low doses, sedatives reduce tension and anxiety. In higher doses, they can cause sleep or even unconsciousness. Common uses include treating anxiety disorders, helping with insomnia, managing seizures, and being used before surgery as pre-medication. Benzodiazepines are some of the most commonly prescribed sedatives. Examples include Diazepam, Valium, Diazepam, Ativan, and alprazolam, Xanax. They work by enhancing the effect of GABA, a calming neurotransmitter, and are used for anxiety, muscle relaxation, sleep, and panic disorders. Barbiturates are an older class of sedatives, now used less often due to the high risk of overdose. Some examples are Phenobarbital and thiopental. They are used for seizures and anesthesia, but are known to be more dangerous, particularly when mixed with alcohol or opioids. Non-benzodiazepine sedatives, or Z drugs, like Diazepam, Ambien, and Diazepam Sonata, are primarily used for insomnia. They are short-acting and tend to have fewer side effects than benzodiazepines. Another type of sedative includes antihistamines such as diphenhydramine, Benadryl, and hydroxyzine. These are used over the counter for sleep and anxiety. It is crucial to note the side effects and risks associated with sedatives. While they can be beneficial, they also pose risks, especially if misused or combined with other depressants like alcohol or opioids. Common side effects include drowsiness, confusion, dizziness, impaired coordination, and memory problems. Before using sedatives, it is vital to consult with a healthcare provider to ensure they are appropriate for your condition and are used safely.